Good morning, everyone. Happy Friday. This is Mandy Cohen, Director of CDC. I'm going to start.
So the CDC finally updated their guidance about what to do if you have COVID and you need to figure out whether you should stay home, which, of course, I had scooped 2 weeks earlier. You don't have to include that part.
That is Lena Sun, my intrepid colleague here at the Post who covers public health and infectious diseases.
So today, CDC is updating our respiratory viral illness guidance to streamline advice to people on how they can protect themselves and others from severe illness caused by common respiratory viruses like COVID, flu, and RSV.
This briefing last Friday was the first time since 2021 the CDC has updated its COVID isolation guidance. And what's notable isn't just what they're recommending, but what they've stopped recommending.
CDC's central recommendation here is simple. When you get sick, stay home and away from others. This is crucial to reducing the spread of illness and protecting others.
Before, they had said you needed to isolate for 5 days. Instead, now they're saying, okay, that's not realistic for a bunch of reasons we can go into. But they're basically saying you can go back to resuming normal activities after your fever has broken for 24 hours without taking Tylenol or other medication, and your overall symptoms are improving.
So basically, if it's day 3 of you having COVID, but you're already feeling better and you've been fever-free, then you can go back to work or to school or to wherever.
We're in a different place, both in the level of protection people have against these illnesses and the tools we have available. We have effective immunizations against COVID, flu, and RSV. We have effective treatments for COVID and flu, and we have more information and tools than ever on ways to reduce the spread of these viruses.
The CDC says that we have to acknowledge that we're in a different phase of the pandemic, but a lot of vulnerable people feel left behind. From the newsroom of The Washington Post, this is Post Reports. I'm Martine Powers, and it's Monday, March 4th. Today, we will hear from Lena about the new guidelines on COVID and what they mean for you. And later in the show, we'll also talk measles and what parents need to know about a high-profile outbreak in South Florida. So, Lena, let's dive into some of the details of what this guidance actually means. Okay, so it's like we're talking right now. It's mid-morning on a Monday. And say after I walk out of the room, I get a little and realize I'm starting to feel sick. What do I do? What does the CDC guidance tell me about how I should then behave?
So the bottom line is a much more common approach, which is when you feel sick, stay home, Martine. Do not bring your germs in and breathe on me.
So when I start coughing, I should just be like, look, I need to head home right now, and I'll finish the rest of the show from my house.
From your house, right? And then let's say you have a fever, right? I mean, it's the sort of common sense advice that they now already have for flu. And so what the CDC is trying to do is put COVID, flu, RSV, and many other common respiratory viruses under one umbrella, and they should all be treated the same. Stay home when you're sick. When your symptoms are improving, you can resume activities, but you can also do additional preventive strategies. And that means you can have cleaner air indoors by cracking open a window, or having a purifier. You can wear a mask. You can keep your distance. And you should especially keep that in mind if you're going to be around people who are at higher risk for disease.
But what about testing? Because when I've had COVID in the past, it felt like my whole experience of that was dictated by like the daily test and having the test and testing every morning to see how bright is the line? Is the line still there? How long has it been since the first time I saw the line? What role does testing play according to the CDC's guidelines?
So now the CDC is saying, okay, in the additional preventive strategies, right, you can also test to see, especially if you're going to be around people who are likely to get sicker because they're older or they're, getting chemotherapy for cancer. But it's now the emphasis is less on testing and day limits and more on your symptoms. Generally speaking, you are less infectious as your symptoms subside. But it is true also that you can transmit COVID asymptomatically without symptoms, or, you may not have fever. So it ain't perfect. The science around infectiousness of this virus hasn't changed. But what has changed is the damage it can do to us. And that is one of the rationales that the CDC is using. The other piece is, we have a lot more tools. Vaccination, antiviral treatment, and 95% of the people who are hospitalized this past season were not vaccinated.
I want to repeat that. Among those who were hospitalized this last season, over 95% had not received an updated COVID vaccine this season.
So the latest version of the vaccine that was made available in the fall targeted the circulating virus that was hanging around in the fall and into the early of this year. Now that's been overtaken by other variants, but the vaccine still works against them. So the best advice probably is to be up to date on your vaccinations. And last week also, the CDC recommended that people 65 and older should be getting a second dose of that vaccine.
Well, I want to talk for a second a little bit more about contagiousness, because it sounds like while you tend to be more contagious when you are exhibiting symptoms, that this isn't like a perfect one-to-one, right? Like, as you said, you can be transmitting COVID asymptomatically. So, like, what does that mean for regular people who are worried about being contagious? And, like, how do you know if you potentially are contagious with COVID?
You can always test, right? But we have to remember, you and I have access to tests at our workplace. Not everybody does. And those tests are no longer free. So you have to look at from a practical standpoint. If you are worried, you can test, but also you can take other measures, right? So if you are going to be around other people, just slip on a mask. It ain't that big a deal. And also you can have your dinner party and crack the window a little bit. We're getting into the nicer weather in the summer, knock on wood, and maybe have the gathering outside. And also remember that we are all much more protected because we have been vaccinated, or in the case of people who have not been vaccinated, they've been sick many, many times, and they have more protection. This virus is not going to go away, and come fall, the CDC and the FDA are already planning an updated version so that people can get it along with their flu shot.
What is the thinking behind wanting to bring COVID under the same umbrella, as you said, as these other respiratory diseases like RSV and the flu?
It's because the basic advice, if everybody takes it, will eventually decrease spread of these diseases. Right now, how many people do you know who actually are isolating for 5 days? Probably not many, right? So we don't know how many people were adhering to this guidance. And I think from a public trust point of view, do you really want to have your leading public health agency be putting out guidance that hasn't been updated and doesn't take into effect what's really happening on the ground? If you talk to physicians,
a lot of people aren't actually following.
Right, not people following. But if you put out some guidance that is simple to follow and easy to understand, maybe you build up your credibility a little bit more. So then when you come out and say, okay, everybody, this fall is going to be very bad, get your shots, people will listen to you. One of the people who I find most thoughtful because of his experience and because of everything he has done is Paul Offit. He's an infectious disease pediatrician at Children's Hospital of Philadelphia. And he has lived through infectious disease outbreaks. And he has been on the Food and Drug Administration's advisory committee that looked at the vaccines and their safety and how effective they were. And he's also been in this sphere for decades. And the point he was making is this guidance makes sense because stop worrying about which virus you have. Do I have flu? Do I have RSV? Because what you're supposed to do is the same.
I think people have this notion that if they don't have COVID, they're good. But all of these viruses can cause other people to be hospitalized or go to the intensive care unit or die. So realize that any of these viruses are bad. And so therefore, stay home while you're sick. Even if you're not in a high-risk group, stay home until you feel better, until you at least have no fever for a day. And then if you have to go back to work, wear a mask, because any of these viruses can do harm. I think what the CDC recommendation says to me at some level is, let's assume that SARS-CoV-2 has entered this pantheon of winter respiratory viruses, all of which can cause hospitalization and cause harm, and that they all should in some ways be treated the same way in terms of caring about your neighbor.
COVID is different from flu, which is different from RSV. But generally speaking, the very young and the very old are the most vulnerable. And we worry about COVID because there's long COVID, and we don't know very much about that. But there's also long flu. After you get flu, you can have all sorts of impacts on your immune system that make you more likely to have cardiovascular issues.
Interesting. And you've mentioned a couple scenarios in which you already saw that the previous guidelines were making it difficult for people to actually live their lives, that not everyone has access to tests on a day-to-day basis. And those things are expensive when you're just buying them off the shelf at CVS. But also, I've heard so much from parents about how hard it is to your kid tests positive. All of a sudden they're home for an entire week. You are having to take work off in some cases for that entire week and figuring out childcare, and that there are so many repercussions from the 5 days of isolation that I think is part of the reason why people weren't necessarily adhering to that. But on the flip side, I do wonder, hearing about people weren't following it anyways, so what's the point? I guess, is there a criticism to be made here of the CDC that they're kind of caving to public opinion of we just want COVID to be over with and we want to get on with our lives, and that they're kind of lowering the bar because a lot of people have stopped caring?
I think public health has to balance what you can do absolutely to prevent transmission of disease against other things that impact the disruptions to society for work and school, exactly like you said about parents. And, kids, if they test positive, then that has a ripple effect throughout the family, right? The kid doesn't go to school. If it's an older kid, they miss a lot of class. The parent has to take off work. And at the same time, other countries have already done this. And guess what? Their data show that there was not an increase in severity or transmission as a result of this, because overall our immunity has increased. California and Oregon have done this. Oregon did it last year. California announced it in January. And then in addition to the greater immunity, there was data that show that cases did not increase in severity and there wasn't additional transmission. It's never going to be an easy balance. And definitely I feel for the people who have weakened immune systems, who feel like they are being left behind or they are going to need more protection, and it's more on them to protect themselves.
Yeah, well, let's talk about those people, because when we're talking about that balance, I think those are the people on the other side who are saying it will be even more difficult than it is now for me to get out in the world and interact with other people with the CDC guidance in place, knowing that people are going to be running around, maybe testing positive for COVID, maybe potentially being still contagious, and that could have a huge impact on me. Well, what have you heard from people who are immunocompromised who have reacted to this?
Those are very legitimate concerns. I spoke to one woman who told me she has autoimmune disease.
I'm Lisa Savage. I am retired and I live in Charleston, South Carolina. I'm 60 years old and just had my first grandchild.
She's very careful. She masks. She limits what she does. She has a sister who has also disease in her family. So they feel very constrained in what they can do. And she told me she feels like she's being left on an island.
I was disappointed because to me it said, oh, well, no one's doing it anyway. So we're just going to go ahead and, not recommend it. And I thought, that's not really your role. That's not your role to say, well, no one's doing it, so we're going to change the guidelines and ask for common sense. Because I think what we've seen over the last 4 years is there's a great deal of lacking in common sense. I had hoped that they would be greater advocates for public health and safety. And for someone like me, it doesn't come across. It just doesn't.
Those are very legitimate concerns, but I guess the bottom line here is if you and I and Joe and William and all those people stay home when we're sick and don't come back and mask and do all those things, then overall, population-wise, there's going to be less transmission of disease and more protection. But it ain't going to be perfect.
After the break, why measles is making a comeback in the U.S. and what parents need to know to keep kids safe. We'll be right back. So, Lena, in addition to COVID, now we are once again at a moment where we're seeing measles become a thing. We're seeing outbreaks around the country. Tell me a little bit about what's going on and where measles has started to show up.
So measles is probably the most contagious disease on Earth. If the measles virus is hanging in the air for 2 hours and you have not been vaccinated, you have a 90% chance you walk through that air, you're going to get it.
Wow.
And for some time now, we have seen measles outbreaks cropping up in the United States and around the world because vaccination rates have dropped significantly for a variety of reasons, which we can talk about. And because people are in the United States, parents are saying, you know what? We don't want our kids to get the measles vaccine. The recommendation for the measles vaccine is 2 doses. It is 97% effective, way stronger than so many other vaccines. So now we've had outbreaks cropping up over the last few years. There was that really big one in Disneyland in 2014. And then in 2019, there was an outbreak in an unvaccinated community, Orthodox Jewish community in New York.
Yeah, I remember we actually talked about this on the podcast back in 2019.
And that spread. There were 1,200 cases that year. That was a record. Already this year, 2024, we have 41 cases across 16 states in the United States. And so there's been attention to this because it just keeps popping up because overall, vaccination for measles is high nationally. But what happens with this disease is if you have a cluster of unvaccinated people, it spreads very quickly. So it could look like, oh, the county is very high, but then you have this little pocket, and that's what's been happening.
And you said measles, it's extremely contagious, that it's a respiratory illness. Like, remind me what happens when you do get measles? Like, what is measles?
So measles is the virus. It spreads, and everybody thinks of the measles rash, the pink spots that you get.
Oh, it's the one with the rash.
It's just the one with the rash, right?
Yeah.
Here's something that I've learned from covering multiple measles outbreaks, unfortunately, which is all the textbooks show measles as that bright pink rash on the white skin. Well, guess what? If your skin is not white, it's much less obvious. It's rose. If your skin is black, it's harder to see. And the thing about measles is 4 days before the rash and 4 days after that rash appears, you are infectious. And your kid might have a runny nose or a cough, and you might just write it off as like, oh, that's little Johnny has a cold. But he could have measles if he hasn't been vaccinated. And the only way you would really know for sure is, and if you don't see the rash, is to feel up at the hairline, which is where the rash usually starts, and you can feel the bumps on the skin. Because measles was eliminated in the United States in 2000, you have generations of parents, you have a generation of healthcare providers who've never seen measles, right? You've never had treated cases. So people don't realize how bad it is. Just like polio, right? We don't see people in iron lungs anymore. It's out of your mind. You don't think about it. But measles can be very, very dangerous. It can cause severe complications, swelling of the brain, ear infections, and it can cause death. One kind of complication, which has this long name, but the acronym is SSPE. If you're a baby and you get it, there is a 1 in 600 chance that the disease will lie dormant in your body. And then years later, it will flare up and you die.
Oh
It's
my gosh.
100% fatal.
Oh my gosh.
And so it's especially vulnerable for babies because the recommendation for measles vaccination is at 12 to 15 months, so when you're about a year old, and 4 to 6. But what we have also seen is if you look at the kindergarten vaccination rates over time, the number of kids whose parents have opted them out of getting the MMR vaccine has been going up. Last year, it hit the highest level ever.
So one of the clusters, as you called them, of outbreaks of measles that we've seen recently is in an elementary school just outside of Fort Lauderdale. And the response to that outbreak, I think, has been, you could probably say, politicized or controversial. Can you talk a little bit about that specific outbreak and what exactly is going on there?
So because measles is so contagious, you have to report it. And measles has been around forever. So there's very specific protocol for how to contain it. Let's say you're a parent and you think maybe your kid had been exposed, and your first instinct is you're going to rush to the doctor's office or you're going to rush to the hospital. But because it's so contagious, you have to call the hospital. So the hospital can send somebody out fully masked and gowned and meet little Johnny and put them in a negative air pressure room so the air doesn't spread. You can't just show up. That's how contagious it is and how seriously public health takes it. In Florida, what happened at this school was a few days after the outbreak became public, the Florida Surgeon General, Joseph Ladapo, sent a letter home to parents that stunned public health and just about every public health society.
In tonight's Health Watch, Florida Surgeon General is defying more than 50 years of CDC guidelines in response to a measles outbreak at a local school.
Because he went against what is the protocol and went against science. Instead of recommending that parents get their kids vaccinated who have not been vaccinated, and instead of recommending that parents keep their kids home, the ones who are vulnerable and who may have been exposed, he said, you know what, you guys? We'll let you decide what you want to do. And the public health establishment and professional societies basically freaked out because it runs counter to science. It runs counter to everything we know about this disease. And this is not a new disease.
But also, I can't honestly say that this is like a surprising reaction, considering that this is Florida. This is a Surgeon General who is appointed by Governor Ron DeSantis. We know his feelings about vaccinations and about his kind of like what he would call empowering parents of young children to make decisions. And Lena, you're like, your fists are waving in the air.
Because I understand how people could have doubts and uncertainties about COVID and the vaccine, because that's new, and we don't know as much about it. What we do know show that it's safe and it's effective. But I understand how parents might not know, because the whole public messaging of the COVID vaccine was really not handled well. But this is measles. There's no doubt about how contagious it is, and there is no doubt about how much harm it can cause your kid. And there is no doubt about how effective the MMR vaccine is. Full stop.
And that's what I think is so kind of hard to understand about this moment. Like, I'm thinking back to you and I sitting in the same room having a conversation in 2019 about a measles outbreak and about the, like rise and lack of trust in vaccines and all the kind of factors contributing to the fact that measles, which stopped being a thing, was like back on the scene. But since then, we've had a whole pandemic and we've seen the effects of people not listening to public health officials, what it takes to prevent a huge number of deaths. And I guess it's just sort of striking that, like, here we are 5 years later, having gone through this whole experience, and that it doesn't feel like the public health infrastructure to prevent these kinds of outbreaks is stronger. It feels like it's weaker.
I agree with you. And I think that you cannot rely on the same sort of public health paradigm to communicate that message. We had that polio outbreak a couple years ago in July. Polio. what you see happening is there's so much more international travel. There's polio abroad. There's lots of measles abroad. In the United Kingdom, they reported 650 cases between October 1 and January. Wow. So it's not just the United States. And part of it is the trust, and part of it is social media putting out all the stuff that's very targeted to your emotions, your fears, but not anchored in data or truth or science. And so if you're a parent and you're not sure what to do, it's much easier to fall into that community and have people validate your fears and concerns. And let's say you may not have a regular doctor, or you can't get in to see your primary care doctor. And your primary care doctor doesn't really know how to talk to you. It sort of starts spouting off the sort of these statistics or studies that you may not understand. It is very sad.
So what do you think this moment tells you, and what are your questions about how this is all going to play out going forward?
I hope that there is some smart NGO or community group that has figured out a way to get ahead of this, and so that we don't see the post-pandemic era being people no longer getting vaccinations for these childhood preventable diseases, which we have gotten rid of. And we don't want, why we go backwards? Technology has done so much for us in terms of being able to produce a vaccine in months' time for COVID. And now we are going backwards with people who don't realize how much harm there could be to not following this guidance. After we wrote that story about this Florida situation, there were over 12,000 comments on that story. And that included many older people who survived measles or saw their siblings or loved ones die because that was before the vaccine, or they had that horrible condition called SSPE. And so when I read those comments, it really hit home to me the importance of getting the right messages out, and the importance of people understanding why they have to do this to keep their children safe.
Lena, thank you so much for unpacking all of this.
Always happy to be here with you, Martine.
Lena Sun covers public health and infectious diseases for The Post. Before we go, some major news from the Supreme Court today. Donald Trump will remain on the ballot in Colorado on Super Tuesday. You might recall that this was a case brought by Colorado voters. They were using the 14th Amendment and a little-known Civil War-era clause about insurrection to argue that Trump was ineligible from becoming president again. They successfully got the state's highest court to rule in their favor, disqualifying Trump from the Colorado ballot. But the Supreme Court has now reversed that ruling, and they made it clear that their decision applies to other states too. In a unanimous decision, they said the Constitution does not permit a single state to disqualify a presidential candidate from national office. That responsibility, they said, rests with Congress and not the states. So that question is out of the way ahead of Super Tuesday. But there is still a lot to keep an eye on as a third of the states around the country decide on who they want as their presidential nominee. This could be the last stand for Nikki Haley. There are a lot of other questions that might be answered on Tuesday. So if you're interested in following the results, you should definitely check out WashingtonPost.com, where we will have live coverage all Tuesday evening. That's it for Post Reports. Thanks for listening. Today's show was produced by Emma Talkoff with help from Alana Gordon. It was mixed by Sean Carter and edited by Maggie Penman. Sometimes when I don't have enough time to read something on the Washington Post website, I listen to it. And it hit me that this might not be a thing that you, as a part of our audience, know about as an option. It is a pretty cool feature. So if you go on WashingtonPost.com, almost every article on our website has a little headphone icon. And if you click on that icon, sometimes you'll hear the reporter or columnist reading their own story. Sometimes it's a computer-generated voice, but you can listen to the whole story. And now we are serving up articles that you can listen to every day in Apple Podcasts. This is a special offering for subscribers of The Washington Post. All you need to do is search for The Washington Post channel on Apple Podcasts and connect your subscription. And if you've not yet subscribed to the Post, you can do that so easily at washingtonpost.com/subscribe. I'm Martine Powers. We'll be back tomorrow with more stories from The Washington Post.